Hi, welcome to the Introduction to Behavioral Services at Imagine. This training will give you the opportunity to meet some of the members of the behavioral team and understand the importance of behavioral services. Awesome. So when we talk about meeting the team, at the top of our org chart is Kristen Cowan, which is me. I am the clinical team leader for Imagine's Behavioral Services, and I'm also a BCBA, a board certified behavior analyst. The other BCBAs on our team are Dan Whittle and Kelly Anderson. And then under them, we've got a couple of our friends who are what we call behavior technicians, or some of them are registered behavior technicians. So registered behavior technicians go through the Behavior Analyst Certification Board, and they complete some requirements and take an exam to be considered an RBT. So Steph Keneally is one of our RBTs. Leah Park is another one of our RBTs. And then we have Annie Tribble, who's our behavior tech, and Bernadette Lambert, who's another one of our behavior techs. So you might see some of our faces around community services, around sites, around the office, pretty much here, there, and everywhere. So if you see us, please feel free to introduce yourselves and say hi. So what do we do with behavioral services? So behavioral services is based off of applied behavioral analysis. Applied behavioral analysis is a therapeutic intervention in teaching methodology that's based on the principles of learning. It's evidence-based, meaning we use data to drive our decision making. And the goal of behavioral services is to work to change socially significant behaviors. Meaning if it's a behavior that's not socially significant, meaning it does not impede somebody being independent or being able to access different environments, then it's not something we're going to work on to change. So for example, somebody might say, well, this individual hums and I don't like that they hum. Well, humming to yourself is not socially significant, so it's not something that we would work on to change. However, if an individual elopes out of a van and they risk the safety of themselves and others, that is socially significant. So that is something we would work to change. With applied behavioral analysis, we use reinforcement to help with behavior change, and we promote positive behaviors. So we do not use punishment. If we were to use punishment, it would require jumping through a lot of hoops. So showing that every single reinforcement that we've tried is not working, and showing a lot of evidence to prove that punishment is needed. And then we would have to get approval from the Human Rights Committee. So realistically, punishment is not something that we ever use. If we do, it's very unlikely, and it's for specific cases or individuals. With applied behavioral analysis, we collect data and use that to show progress. So the progress that an individual makes is observable, it is measurable, and the interventions that we use, we modify according to the data analysis. So according to how the individual is doing, and if they are increasing a skill or decreasing a behavior that is maladaptive, we make changes to those interventions or behavior plans based on the evidence of the data collection. So now that you know kind of what ABA is and what we do, now it's time to talk about who provides these services and kind of what these services look like. So like I said earlier, for the behavioral department, we have two kinds of staff. We have the BCBA, or Board Certified Behavior Analyst, and then we have our behavior technicians or our registered behavior technicians. Sometimes you'll hear people even refer to this individual as line staff. The term line staff just comes from the funding source for Medicaid. So that's why that term line staff pops in there. But realistically, we would probably refer to them more as behavior technicians or RBTs. So, and then don't forget, the third category is the DSPs. So that's you guys. So those are our direct support staff or direct support professionals. So those are individuals who are instructors or facilitators or any people who work in community services, people who work in residential, any sort of caretaker that provides additional services to the individuals we serve. So what happens is an individual gets behavioral services. So somebody identifies a need for behavioral services, and the BCBA will conduct an assessment. Usually we try to do that assessment within the first 30 days of getting funding and securing funding. So once we get the assessment conducted, the BCBA will identify kind of the function of a lot of the behaviors and some of the skills that the individual will need to learn to replace some of the more maladaptive behaviors. After that assessment is completed, the BCBA will create a treatment plan or different behavioral intervention plans. And some of those intervention plans can be really specific and really detailed, which might require them to only run them themselves as the BCBA and maybe train people in other parts of the plan. Or maybe they'll create a plan where they run the plan and then they train the RBT, or they'll create a plan where they train them. They want themselves to do it as the BCBA. They want the RBTs to do it, and they also want the DSPs or other caretakers to implement it as well. So there's a lot of different things that are added to these treatment plans. So when you are trained, you might be trained on parts of a behavior plan that we know are applicable to you and your job, or you might be trained on the whole thing. It really depends on the individual and how services are being provided to that person. So then lastly, what the BCBA will do is they will train the behavior technician, the line staff, or the RBT, whichever term you want to use, and then sometimes they train the DSPs. So the behavior technicians are kind of our trained direct support professionals. So there are trained individuals in the field of applied behavioral analysis. And what they do is they run specific programs that the BCBA asks them to do. Another thing that's important about this role is behavior technicians, or RBTs, according to the Behavior Analyst Certification Board, BCBAs are required to provide a certain percentage of supervision to that individual. So it's kind of this ethical requirement that BCBAs are overlapping with our behavior techs or our RBTs to ensure fidelity of treatment. So to make sure that they are doing the treatment the right way, we are required as BCBAs to overlap and supervise anybody who's working under us and running programs for the BCBA. And then last category we have is the direct support professionals or direct support staff. So these are you guys, the residential staff, any caretaker, right? So these individuals, what you guys do is you work with these clients all the time. You work with them up to 20 hours a week. You know, sometimes even in the residential field, you live with them or you work with them in the home. You carry out the basic parts of behavior plans. A lot of the times we'll teach you how to avoid target behaviors. So those are behaviors that we're attempting to decrease, and how to manage behaviors if they occur. So our goal will be to teach you at least a really good foundational amount of skills to work with that individual. The important thing to know, though, is that we need teamwork. And the reason why is client funding is extremely restricted for adults. Once an individual turns 21, they can be on one of two waivers. They can be on the DD waiver, which is kind of this, the best way to explain it is it's money from the state through Medicaid that is given to an individual, and there's kind of like a bag of money allocated for multiple services. So if an individual wants to go to day program, there's a bag of money for day program. If the individual needs residential supports, there's a bag of money for residential supports. If the individual wants behavioral services, there's a bag of money for behavioral services. So even with that, bag of money that is literally specified for behavioral services, the most we get for that individual is an hour a week with the BCBA that is paid for, 4.5 hours a week with the behavior tech, and it's not a lot, and just a little funding here and there to help train staff. So because that's so restricted, DSPs are the biggest part of this puzzle because they work with the individuals the most. If we look at the SLS waiver, that's even more restricted. So the way that that works, to simplify that, is an individual is given just one bag of money. And with that bag of money, they have to determine how they're going to allocate all those funds. So they can decide, okay, well, this is my lump sum of money. I need to put this towards DSP work. This towards behavioral services, this towards community services, this towards residential. And the thing about that bag of money is, since it's not a certain amount for each section and it's one big lump sum that they have to divvy up, a lot of the times there's not room for behavioral services because the money is being used for day hab and residential. So there's not a lot of money that can be offered to provide those additional supports, which is why a lot of the times if those individuals on the SLS waiver do need behavioral supports, we end up having to pull from other departments or other services, or we have to try to do just as much work that we would do with other clients with even less funding, which means even less time, which means we are going to rely on DSPs and facilitators even more as a bridge to support the gap in funding to support the individual. And then last but not least, you have EPSDT, which is for individuals under the age of 21, and we have private insurance, which all of those vary, and those can be usually a decent amount of funding. So children and private insurance offers a lot more than what our Medicaid waivers offer for the adults that we serve. So the whole point of explaining this funding was to let you know that teamwork does make the dream work, okay? So if a BCBA has already, even with the most amount of funding for an adult possible, an hour a week to work with them, and DSPs are, and then an RBT has 4.5 hours of work with that individual week, but then a DSP is 20 hours a week with that individual, we need your help to implement behavior plans. And we also need you to give us feedback of any sort of barriers that are getting in the way for you to be able to implement a behavior plan, or if there's a barrier, something that's going wrong with the behavior plan, or if you have a question or any of these things. We need that open communication and that relationship to be strong so that you can feel comfortable saying, you know, Kristen, this intervention's not working, and either I'm doing something wrong or it's just not a good intervention. And then I'll say, cool, let's look at it and see what's going on. You have to understand that we, as BCBAs, we know that sometimes there are things that work great in theory, and research shows they work great in controlled settings, but we don't work in a controlled setting. So that feedback helps us to understand what we can do to make sure that you're supported in supporting the individual. But consistency is key, so it's really important. You'll also notice too that if you're curious or you'd like to work on some of the specific goals that maybe a behavior tech or a BCBA is working on, always ask. So sometimes you might not be trained in a behavior plan or a certain intervention, but you might see an RBT or a BCBA doing something different. Unless you're trained in it, we ask that you don't try it because consistency is so important. But if you're curious and you're like, I want to learn how to do that, or I want to support the individual that way, just ask us, and we'd be more than happy to let you know where we're at and what we can do to support you with that. So let's take a look really quick at how the services are provided. I already touched on this briefly, so we'll just go through this really quick. So when it comes to assessments, if we get the full amount of funding for an adult, we only get 10 hours. And that gives us 2 to 4 weeks usually to complete a 10-hour assessment to try to determine the function of the behaviors that are interfering with the individual's ability to be as independent as possible. So we use that time to conduct a functional behavior assessment, which means kind of just grabbing evidence from all different areas through interviews, through observations, through data collection, through record reviews, through all sorts of stuff. We compile all that information to try to identify a pattern that we can prove. When we get a treatment plan, that usually takes a few weeks to complete. By the time we're done with the assessment, we need a few extra weeks to create the treatment plan. And we do this based off of the assessment results and research. And then the last step is training. So this is when we train DSPs, we train RBTs, and everybody who might be included in implementing the behavior plan or the interventions. And The expectation is that when you are trained, that after that point, you follow the behavior plan. You follow the plan, you go through the training. That is your time to learn how to do it, to ask questions, to do anything you can. And then after that training, the expectation is that you will be implementing that plan the next time you see that individual. And it's a lot to keep track of. We know that. I mean, there's a lot of individuals you serve. There's a lot of different plans. We try our best to try to make them consistent so that you're not having to do something completely different with client A and then something completely different with client B. And we know that mistakes happen. I mean, we're all human. And a lot of the times you'll even see RBTs or maybe the BCBAs training staff as we go, right? So we might do a training and then say, all right, well, when the client's with you, we'll come and overlap and we'll make sure that you're getting additional training in the moment with the client present, things like that. If you need any extra support, just ask, reach out to us, give us an email, give us a call, give us a text, stop us when you see us, any of those things. But we thrive off of communication, and it's what helps us to benefit the individuals we support and to support you guys as well. So the importance of data collection is that it measures a plan's effectiveness. So we may ask individuals to collect data, or a lot of the times we try to take that burden off of staff and do it ourselves, but there are some times that behaviors don't occur in front of us. So we might need other individuals to collect data. And we do that because it helps us to know if the interventions or the behavior plans we've implemented, if they're working. If behaviors are not getting better, or if behaviors are not decreasing that we want to decrease, then our plan's not working. You know, if a maladaptive behavior is getting worse and not getting better, then it's not working. And if a skill is getting worse and it's not increasing, then our plan's not working. So we use data collection to let us know, how are we doing? And we rely on RBTs and DSPs to collect the data. We review it to determine if a plan in place is in fact the best practice for that individual, for that environment, for everybody involved. It's important for us to know if it's effective or not, because if it's not, we will change the plan. Or if it is, we will keep it and we'll show everybody, look at the great progress you guys are all making, and everybody's a part of that. Our job as BCBAs and on the behavioral team is to work ourselves out of a job. So we are provided like a referral for an individual who needs help, but our goal is to kind of help that individual not need our help anymore so that we can discharge. This doesn't mean that we rely on DSPs to run all of our behavioral programming. Instead, what we do is we just focus on setting our clients up to no longer need behavioral services. So the main goal is any form of self-management that's possible, or any form of just learning that can help the individual adapt to their environment in a more effective way. So now that I've explained kind of everything that is ABA and is behavioral services and why you guys are such a huge part of what we do, I would like to take a second to just kind of talk about like a little intro to kind of the behaviors that you'll be seeing in this field. So some of the most common behaviors at community services include refusals, which is if somebody says like, no, they don't want to participate, or they maybe don't attend class or work. Disruptions, which would be maybe an individual yelling or cursing or hitting objects. Maybe they're crying or whining, not related to pain. So just, oh, they don't like me, kind of like that kind of crying or whining, or even stomping. We also have elopement, which is when somebody wanders or maybe deliberately runs away or towards something. We have stealing, where individuals take something that doesn't belong to them, or they might trick others into giving them something through a trade or manipulation. And then the more serious behaviors are aggression, which is hitting, kicking, or even maybe throwing objects directed at a person. And then self-injury, and this could be hitting yourself, the individual hitting themselves, banging their head on walls or tables, or pulling out their hair. So the 4 functions of behavior that we look for in our assessments are attention, escape avoidance, access to tangibles, and automatic. So when we do a functional behavior assessment, we collect evidence on each behavior that we are trying to reduce. And we try to determine why is that behavior functioning for that individual in their environments, okay? What is the function behind that? So is the individual aggressing on staff because they want attention, because no staff has paid attention to them for 2 hours and they're bored, so they want this attention from staff, and the best way to get it is to punch a staff? I'm going to try to use the same example for the whole thing. Are they punching staff because they're trying to escape or avoid a task? So every time a staff member asks them to do the activity, if they swing at the staff to try to punch them, the staff leave them alone, and then they don't have to do the activity. So are they trying to escape or avoid something? Are they trying to get access to tangibles? So every time they punch a staff member gives them an iPad to help them, maybe calm down, or to help them, use a coping skill. So maybe they're just learning to punch people to get an iPad rather than ask appropriately for an iPad. Or are they just punching staff because it feels good? It's something internal that's an automatic function. So, kind of the same way for you guys to relate, why do we scratch and itch? Because it feels good, right? So things like that. So we do our functional behavior assessment to identify the function of those behaviors. So let's take a look at some of these. So here we go for some examples and things like that. So when we have attention, right? Physical attention could be things such as high fives, handshakes, pats on the back, hugs, etc. Prompts, physical prompts, hand over hand assistance, or physically asking them, physically assisting somebody in completing a task. That's another form of attention. And even talking about someone is a form of attention. So anytime a staff member talks about a person or their behaviors within earshot, that individual may be gaining attention. So how do you manage attention maintain behaviors? These are just some quick tricks for you to learn at the beginning of kind of your career in this field. First thing you need to do is ignore the behavior, not the person. You're ignoring the behavior that they are engaging in to get attention. You're going to pivot your attention to those who are doing well. So those who are engaged in the activity or following staff expectation. You're going to provide lots of specific praise. So tell the individual specifically what it is that they are doing correctly. And sometimes it will be good for a client to know you heard them. So for example, if somebody's just whining or yelling or crying or telling you that you're a horrible staff member, and they're perseverating on it, so they're just doing it over and over and over again, you may have to give some minimal attention to it. So you might have to say something like, I'm sorry you feel that way, but there's nothing we can do about it now, so I'm going to do art, and I would love if you joined us. And then you don't acknowledge requests or behavior after that. If the complaint's brought up again, you could just say, okay, or I heard you, or nothing at all, right? You don't show them that the behavior affects you. You want to keep your face and your tone neutral. And sometimes it's necessary to remove peers because peers might not be able to help but pay attention to that certain behavior. So even though the staff member is doing a really great job of pivoting their attention, maybe the peers aren't doing such a good job. So now let's look at escape and avoidance. So examples of escape and avoidance is maybe trying to escape a demand or maybe avoid a task. Or maybe the individual is trying to avoid an environment or maybe an activity or maybe even a person, whether it's a peer or a staff member or a community member. So when it comes to managing escape maintain behaviors, your goal is to the best of your ability, do not allow the behavior that the individual is engaging in to result in the termination of the task. So we say this when we usually call this holding the prompt, right? So if I say, hey, Bob, we are going to put our lunchbox away, and Bob starts yelling and screaming, we are not going to be say to Bob, okay, Bob, you don't have to put it away. I'll do it for you, right? Just because he's yelling and screaming. What we're going to do is we are going to hold the prompt. And the way that you can hold the prompt is by even having alternative behaviors ready. So pre-cueing an individual. So, hey, Bob, we're going to put our lunchbox away. If you get frustrated, I'd be happy to help. You just need to ask me for help, right? So in that case, Bob might try to put his lunchbox away, or he might say, Kristen, I need a break, or I need help. And then I'd say, okay, Bob, that's great. Thank you for communicating that and for engaging in an adaptive behavior, an appropriate behavior, right? Rather than yelling and screaming, he said, Kristen, I need help. Then I would be able to help him, right? So that alternative behavior is going to allow him to maybe escape or delay a task. But because he engaged in that appropriate behavior, that escape or that temporary escape or delay is okay. However, but if he had engaged in the yelling and screaming, I should not then give him a break or a way to escape the task, okay? So the reason why is because if Bob says, Kristen, I need 2 minutes before I'm ready to put my lunchbox away, I'll say, Bob, thank you so much for telling me what you need. Of course, you can have that. So I'm giving him reinforcement or allowing him to delay a task because he asked me in an appropriate way. If he yells and screams and I give him the opportunity to delay or escape that task, then I just taught him that not talking to me appropriately gives him that ability, but yelling and screaming is what allows him to escape or delay a task. So we want to focus on the alternative behaviors if we are going to provide that option. We want to make sure these things, though, that are fun come after a task, right? So a lot of the times we talk about using first, then language. Hey, Bob, first put your lunchbox away, then we're going to go on a walk, right? Bob loves walks. That's awesome. He's going to more likely to do the low probability task of putting his lunchbox away because he enjoys walks, okay? So just make sure that you're setting yourself up for success, especially when people have escape maintain behaviors, by making sure that you have those alternatives ready. You're holding that prompt and making sure that they complete the task that you presented. And then also making sure you use first then language. It's super helpful with escape maintain behaviors. The next one is access to tangibles. So an individual might engage in behaviors to access maybe an iPad or a preferred activity or a preferred item. So how do we manage access to tangible maintained behaviors? You'll have an alternative behavior that will allow access to the item or activity. Kind of similar to what we just talked about in escape maintained behaviors. That alternative will give them access to the item rather than the behavior we're trying to reduce, which might be disruptive. If the item or activity that they want is something that's not available, so for example, like they want a soda and they're not allowed to have sodas, or they want money, or and they're, you can't give them money, right? You want to make sure that you set up your environment for success, right? So if it's not something you can give them, you're going to want to maybe pivot the discussion to something you can. Another thing too that you're going to want to do is lock up items that a client can't have, right? If they can't have them, they shouldn't be available to them because it's just going to cause more problems. A great thing is to set up guided access on iPads. If you need help with this, please ask any staff member. They know how to do, they know how to set that up. Some of our clients have a hard time handing over an item or a tangible after they've gained access to it. So if you say, hey, Bob, it's time to turn the iPad off, it might cause them to engage in maladaptive behaviors like screaming and yelling and banging on the table. However, if you set up guided access, the device shuts down itself, and it just kind of is this natural event that individuals are used to, right? Things power off, things, batteries die, whatnot, and it takes you out of the equation. So make sure you work on setting up guided access. Keep items out of sight or out of reach if you can. And we don't negotiate with people. If something is possible on another day, you set up a day and a time for that activity and you stick to it, right? Don't say something like, we might do that later, because if it doesn't happen, you might have more behaviors to deal with. And that just is going to, that maybe of like, we might do it, to them might be a definitely, right? So you just need to make sure you're setting yourself up. If you don't know if you can do something, you can just say, I don't know. Rather than saying we might do that, just say, I don't know. And that's a perfectly fine answer. Last but not least, automatic. So with automatic, there actually is no social consequence. So these behaviors are done because they feel good, or they're reinforcing in itself. So when you want to manage automatic maintained behaviors, the problem is since there is no social consequence, ignoring or any other things that we might have taught you to do for attention, tangibles, and escape avoidance, they're not going to have any effect. So the client does these behaviors because the behavior itself is reinforcing. Picking your nose to that's reinforcing. Scratching an itch, that's reinforcing. If a behavior happens, you should prompt a high probability or an incompatible behavior. So if a behavior is compulsively reordering objects, you might maybe instruct the client to keep their hands in their pockets during transitions. That's an incompatible behavior. You can't reorder objects with your hands if your hands are busy in your pockets. And these are difficult. These are the most difficult to manage because there's not a lot you can do. So you're just going to want to prepare yourself by having a bunch of incompatible alternative behaviors. You're going to want to pre-cue and even have like a list of high probability behaviors. So behaviors the individual is likely to comply with. You want those in your back pocket so that you can have those ready to prompt the individual when the automatic maintained behavior occurs. So things to avoid on a shift. This is just kind of good advice. You learn some of this in safety care too. We want to avoid words like no, don't, and can't, right? We want to instead use other language, which we'll talk about in a little bit. You want to avoid bargaining, right? Bargaining is when, oh, well, if you do this for me, you can, I'll let you do this. You don't want to have that kind of language. You want to set up clear contingencies or clear agreements with the individuals or expectations. You want to avoid power struggles. And you want to avoid lecturing. You guys, if lecturing an individual about, why it's wrong to steal worked, then nobody would steal. Unfortunately, it just doesn't work to lecture individuals. It would be great if it did, but unfortunately, it just doesn't. The longer you talk to somebody about something, the more attention you're bringing to a scenario. So it's really something we want to avoid when we are on shift. Things to do on shift, though, is pairing. We want you to pair with individuals so that you can build or maintain rapport with a client. We want you to use priming, which is a verbal countdown. So maybe we're going to stand up on the count, we're going to stand up in 3, 2, 1, up. That would be an example of priming. You want to use the PREMAC principle. So first, then language. So first you're going to put your lunch away, then we'll go on a walk. Or if you put your trash away, then we can play with Legos. So a low probability activity first, so something that the individual's not likely to comply with, followed by something that they are very likely to comply with, high probability. You want to use behavioral momentum. So make requests that are easy for the client before making requests that are more challenging or difficult. And just reinforce the completion as you go along. Build that momentum through reinforcement. Use positive reinforcement all the time. It should be your most common thing out of your mouth is any sort of social praise when people are on track with activities and using those adaptive skills that help them to increase their independence. Set yourself as a staff member up for success. Make sure if an individual asks for an iPad and you say the expectation is for you to be on it for 2 minutes, use that guided access to take a lot of that kind of pressure off of yourself. And focus on expectations. Every single shift, every single day, you should have your expectations set up already. So, high fives and handshakes is all I give to clients. At 9:30, the expectation is to be in class. So make sure you understand what the expectations are for the class, for the activity, for your shift, for the department, and for the individuals you're working with that day. And just make sure that you're setting yourself up for success as well. If anything comes up during your time at Imagine, we highly encourage you to contact us with any sort of questions or feedback or anything you'd like to give us. We love to hear from those who do so much for the individuals we serve. So please feel free to reach out to us at behavioralclinicians@imaginecolorado.org, and we'll get back to you. We appreciate your time and we wish you the best of luck in all that you do to support the individuals we serve. Have a great day.